Ever open a Med Surg chapter, see all the bolded terms and feel lost before reading the first line? I've been there. Hi friends, I'm Nurse Mia and welcome back to the GetZen RN study group. This part 1 of the chapter, Key Terms Made Simple. That's exactly why we start here, because those terms make the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Those words are the foundation. Without them, you'll read the whole chapter as a guesswork. Most chapters start with 10, 40 terms, and each one connects at least one clinical pathway: lab, symptoms, nursing intervention, diagnostics. These are just test words. They show up in NCLEX terms, in nursing reports, and real patient conversation. Imagine your patient says, "Nurse, the doctor said my atrial fibrillation is causing hypertension and it might be from polypharmacy. What does that mean?" You will need a language not just to understand it, but to explain it with confidence. Let's break it down term by term, Q by Q, calm and clear. Let's get started. Chapter 22, Coordinating Care for Patients with HIV, has 15 terms. And the first term we start with AIDS, a chronic, potentially life-threatening condition caused by HIV. It presents the most advanced stage of HIV infection, defined by a CD4 plus count with less than 200 cells per millicubes, or an AIDS defining condition. So the next one, those key terms, their definitions, and usually they are used in quizzes and exams and ATIs or Kaplan's. So moving forward, AIDS, defining condition, opportunistic infection or cancers that mark the progression from HIV to AIDS. So example include the Kaposi sarcoma, the PCP, and tuberculosis. So their presence in an HIV positive patient defines AIDS regardless of CD4 plus count. Next, it's ART, antiretroviral therapy, ART. So medication regimen is used to control HIV infection. So ART reduce viral load, also increases the CD4 plus count, and prevents progression to AIDS. Adherence is critical for treatment success. CD4 plus leukocytes count, a measure of immune function by assessing helper T cell level. So the normal range is between 500 and 1500 cells per meters cubes. A count less than 200 indicates AIDS, used to monitor immune recovery on ART. The human immunodeficiency virus, HIV, a virus that attacks the body immune system, specifically CD4 plus T cells. So the HIV levels to AIDS if untreated. So HIV leads to AIDS if untreated. Spread via blood, semen, vaginal fluid, and breast milk. Early treatment is essential. Immune reconstruction inflammatory syndrome, a paradoxical worsening of pre-existing existing infections after ART initiation. So actually occurs as immune system begins to recover and mounts inflammatory response. It requires close monitoring and sometimes the steroids, corticosteroids. Down the page. Occupational exposure, contact with potentially infectious materials during work activities. So this is most often from needle sticks. Nurses should follow the PPE protocol immediately. Opportunistic infection, OI, infection that occurs more frequently in immunocompromised individuals. So this is common in HIV/AIDS, for instance, the PCP candidas. Also think about the prophylaxis and early ART initiation are key to this prevention. Okay, PCP. Shall I try to say it? Oh my goodness. Pneumocystis, Carnini pneumonia, a serious fungal infection and a common AIDS-defining illnesses. So this presents with fever, cough, and dyspnea. We can treat it with a treatment called TMP SMX, where the CD4 plus is less than 200, often triggers prophylaxis. Post-exposure prophylaxis, so the PEP, short-term ART, given after potential HIV exposure, must be started within 72 hours of exposure and continued for 28 more days. Is used for healthcare workers or sexual exposure. The pre-exposure, post means after and pre means before exposure to prophylaxis. The PrEP is preventive ART. So the post is a short term. The pre-exposure, which is before, it's the preventive ART for HIV negative individuals for high risk. So taken daily to reduce the risk of HIV acquisition. So it requires also regular HIV testing and also monitoring for side effects. The Zero Convention, development or of detectable antibodies to HIV in the blood. It masks the transition from HIV negative to HIV positive. So the symptoms may mimic flu. Typically occurs like 2 to 4 weeks post infection. Post, it's after. Serodiscordant, a couple where one partner is HIV positive and the other is HIV negative. So the PrEP, ART, adherence, and viral suppression helps prevent the transmission. And we go almost to the end. So the viral load is the amount of HIV RNA in the blood. So this is used to monitor the art effectiveness. The goal is to undetectable, like the less 200 copies per ml, which also prevent the transmission. The viral set point stabilize level of HIV after initial infection and immune response. So this is to predict disease progression, lower set point, and also slow progression to AIDS. So this is the end of the 15 terms from this chapter. It's time for me to check out and tell you my all thanks and goodbyes. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.